My name is Alex Foad, but I am known as Old Man Jenkins. And I smoke a lot, and I've had a lot of gastric ulcers throughout my lifetime. My granddaughter took me to eat lunch together.
I'm Old Man Jenkins' granddaughter, Casey. I have duodenal ulcers and I'm very stressed.
Hi, I'm Jen. I have rheumatoid arthritis, which is a chronic disease, and excessive NSAID use to cause gastric ulcers.
Hi, I'm Marin. I have a duodenal ulcer from chronic fatty food and alcohol use.
Hey guys, how you been?
Good, how about you?
Not too bad, just traveling a lot.
Long time no see.
Yeah, it's been a while. What have you been up to?
Oh, not much. Same old, same old.
Yeah.
Thanks for waiting for me.
Oh, I'm sorry, Grandpa. This is Grandpa. Grandpa, this is Jen and Marin.
Nice to meet you fine young ladies.
You look like you're not doing too well.
Yeah. We went to all you can eat. My stomach really hurts, and so I'm trying not to eat as much, but the cigarettes really help. Doctor says that I need to stop eating after I start feeling pain. So, yeah.
That's weird because every time I don't eat, I get pain. So I'm just eating constantly. I think I put on a little weight. What do you guys think? Okay. Well, I figure bigger the better as long as I'm not in pain.
Yeah, actually people said I've been losing weight. I've been so busy with work. I'm just so stressed. Had to have Grandpa move in with me so I could pay the bills, you know what I mean?
Don't put that on me.
Well, I'm tired of taking care of him, so.
You are looking a little pale.
Yeah.
My RA has been so bad lately. I've been taking like 6 Tylenol in the morning, 6 at night, a few throughout the day whenever I feel like the pain's just really bad, and my stomach's really starting to get upset about it.
Man, I haven't been sleeping well either. The pain wakes me up in the middle of the night, have a little snack, and try to go back to bed. Sometimes I even drink wine.
Man, I think we need to go to the doctor, you guys. This doesn't sound right.
I think you're right.
1 week later.
So, hey, how'd it go last week in the doctor's office?
Well, my doctor told me that he wanted to know a little bit more about my problem, so he asked me questions like, where's the pain? How bad is it? When does it hurt? Where's it located? So when I told him it's, up in here, in the epigastric region, he told me that he was pretty sure I had peptic ulcer disease. And he said it was not helped any by my excessive popping of Tylenol, but because it can also be caused by a bacteria called H. pylori. He took a stool sample. They block the release of prostaglandins, and it breaks down the mucosal barrier in my stomach, making me more susceptible to ulcers.
Interesting.
Wow, that's very interesting. Well, I got some info for you guys. Gastric ulcers are more common in older people. Well, the other day I went to the hospital and I had some problems. So they put a camera down my stomach, and I think it was like a endoscopy or something like that.
Oh, you got it right that time.
Yeah, my Alzheimer's were kicking in. But anyway, so they put this camera down and they found out I had an ulcer in my gastric mucosal lining. So they put me on a PPI inhibitor.
What's a PPI inhibitor?
Proton pump inhibitor. This proton pump inhibitor eliminates the total blockage of hydrogen ions into the gastric lumen. So I took that for a while. I had symptoms of diarrhea. So, hold on, I need a smoke. Anyone got a smoke?
No, Grandpa.
No?
You've been cut off.
Alright, so I took H2 antagonist because of the symptoms, and that is Peptic or famotidine. This blocks the gastric acid secretion into the stomach. It's important to take both of these medications 30 to 60 minutes before you eat, because if you have it with food, it decreases the medication's absorption. So, also you need to focus on side effects with famotidine, which is dizziness and constipation.
Hey. Yikes.
My doctor told me I have deep ulcerations in my duodenal wall, and maybe they're going all the way through. I've been bleeding for a while now, apparently, so I guess maybe that's why I have the anemia. That makes sense.
Definitely.
Is he doing anything for your anemia?
I'm taking iron supplements to remedy my anemia.
Good. Well, the doctor
Good
told
for
me.
you, granddaughter.
The doctor told me that my big fatty meals that I eat all the time and my constant wine drinking has led to my duodenal ulcers.
Stop.
It's probably because I love In-N-Out so much. And I drink about 4 glasses of wine a day. The doctor told me it's really important to get treatment because if we don't, we could get symptoms or complications such as GERD, hemorrhage, or bowel obstruction.
Ouch.
I've had those.
Duodenal ulcers often heal spontaneously, so my doctor put me on an antacid Tums. I'm also taking a proton pump inhibitor, Protonics. It inhibits the transport of hydrogen ions in my mucosal lining, and it decreases the gastric secretions.
And how soon does that work?
Within 24 hours.
Wow, fast.
Yeah,
Turn off
sorry
your
guys.
phone.
Sorry, I thought I did. Young kids these days, huh, Grandpa?
Yeah, like technology weirdos.
Just getting an update on the game.
It decreases 90% of the acid secretions in my stomach. The doctor told me I might have GI upset, so I have to report to the hospital if that gets out of control. The drugs associated with C. diff and also osteoporosis, so I really got to cut down on my stress so I can get off these medications.
I'll try and be better for you.
My doctor gave me amoxicillin to treat the H. pylori and Prilosec to prevent further exacerbations. He also told me that I need to cut back on my Tylenol use and we look for other medications to treat my RA. That is not nice, Grandpa. Not nice at all.
That's weird because I got a different drug called like sulcrophate.
Yeah, sucralfate.
Oh yeah, sulcrophate. That's right. I take it 4 times a day, before meals and right before bedtime. It actually forms a protective layer over the ulcers in my duodenum, and but I have to watch out for constipation and dry mouth. So I just keep drinking my wine.
Hey, it's a good solution.
Did you know that ulcers are superficial, deep, acute, chronic, multiple, or single?
No.
It's interesting.
Also, they're most common in younger people, such as you 3.
I'm on the older end of that spectrum. Keep going. Tell me more.
Anyway, they can occur in spring and fall, so you can have an exacerbation at any time throughout the year.
So you mean like now would be an exacerbation time?
Makes sense why we all have ulcers right now.
It's also important to avoid black pepper, hot sauce, or any other acidic foods that can really cause an exacerbation of gastric acid, like reflux.
How about that smoking?
Mexican.
Well, anyone got a light?
No.
All right.
No, they. Where did you get that cigarette from?
Found it on the ground.
Because that's a good idea.
Cheers.
I gotta stop drinking the Diet Pepsi because the carbonation's wearing away at the lining of my stomach. At least that's what my doctor said.
I'm so full. I think I'm gonna go lay down.
No, don't do it. It's best
Why?
to stay upright for at least 30 minutes after eating.
Oh.
Maybe you should eat a little less and a little smaller meals too, Marin.
Here.
Just because you don't eat it doesn't mean she gets it.
Cheers.
Sucralfate, also known as Carafate, is part of the GI protectant pharmacological class. It is used as a mucosal protectant in the treatment of active ulcers and in long-term therapy for stress ulcers, such as PUD. It acts locally, binding directly to the surface of ulcers. The aluminum salt reacts with the gastric acid to form a thick paste, which selectively adheres to the ulcer surface, forming a protective barrier. This limits the access of pepsin and stimulates secretions of prostaglandins. The normal dose is 1 gram 4 times daily, orally. Adverse effects to look out for are nausea, constipation, dry mouth, hyperglycemia. It is important that the nurse understands that this drug interferes with the absorption of other drugs, so it should be taken 2 hours before other medications are administered. It is usually given 1 hour before meals and at bedtime. It is important to educate the patient to assess for frank or occult blood on stools.
Famotidine, also known as Pepsid, is a histamine 2 receptor antagonist used for peptic ulcer disease, upper GI tract bleeding, and stress ulcer prophylaxis. It completely blocks H2 receptors of acid-producing parietal cells so they become less responsive to histamine. It lowers the hydrogen ion secretion from parietal cells and increases the pH of the stomach to help relieve hyperacidity. Adverse effects are confusion, headache, lethargy, disorientation in elderly, increase in secretion of prolactin from anterior pituitary gland. Important nursing considerations are you want to administer over 2 minutes and monitor for hypotension and 30 to 60 minutes before meals.
Pantoprazole, also known as Protonix, is a proton pump inhibitor. It's a first-line IV treatment for peptic ulcer disease. It's indicated for short-term treatment of active duodenal ulcers, gastric ulcers, NSAID-induced ulcers, stress ulcer prophylaxis. Can be used in combination with antibiotics to treat H. pylori. It's dosed at 40 milligrams once a day. It can be orally or IV, up to 120 milligrams 2 times a day. Binds to an enzyme in the presence of acid gastric pH, preventing the final transport of hydrogen ions into the gastric lumen. Headache, pseudomembranous colitis, abdominal pain, diarrhea, hyperglycemia, and bone fractures. Nursing considerations: administer 30 to 60 minutes before meals.
Omeprazole, also known as Prilosec, is a proton pump inhibitor. It is first-line therapy for erosive esophagitis, short-term treatment of active duodenal ulcers, and active benign gastric ulcers. NSAID-induced ulcers, stress ulcer prophylaxis. It can be used in combination with antibiotics to treat H. pylori. It works in a way that is more powerful than H2 receptor blockers because it binds directly to the hydrogen potassium ATPase pump mechanism and irreversibly inhibits the action of the enzyme, which results in a total blockage of hydrogen ion secretion from the parietal cells. Its dose is by mouth 20 to 60 milligrams per day for 4 to 8 weeks. Its side effects is minimal. It may predispose your GI tract to infections such as C. diff, and nurses need to remember to give it 30 to 60 minutes before meals.
All right, class, I'm going to enlighten you on one last thing about PUD. PUD is a general term for gastric or duodenal ulcers that involve digestion of the GI mucosa by the enzyme pepsin. A peptic ulcer equals the breakdown or ulceration in the protective mucosal lining somewhere in the GI tract. It can occur in the lower esophagus, stomach, or duodenum. Specifically for gastric ulcers, they occur in the stomach. They occur equally in males and females. They're most common between the ages of 55 and 65 years old, and a fourth is as common as duodenal ulcers. Now, talking about duodenal ulcers, they are deep ulcerations in the duodenal wall that extends as a crater through the entire mucosa and muscle layers. They are most common and tend to develop in younger people. This may be associated with patients with type O blood. Cheers.